My name is Marina Latvinsky, and I'm a family nurse practitioner student at William Patterson University. And today I will be demonstrating thoracic, pulmonary, and cardiovascular focused examination on this patient. Do you give consent
Yes.
to the examination?
Yes.
Okay. So this patient is an 18-year-old female with no past medical history, no known allergies. Her vital signs are her temperature is 98.4 degrees Fahrenheit. Her heart rate is 74 beats per minute. Her respiratory rate is 16 respirations per minute. Her blood pressure is 114 over 68 millimeters of mercury. And her oxygen saturation is 99% on room air. So I have washed my hands and I'm going to start the examination. So I'm inspecting her general appearance. She's alert and oriented ×3. She's in no acute distress. Her skin tone is even and appropriate for her ethnicity. She's warm and dry to the touch. I'm looking at her nares and her lips, and they're pink and moist. There's no signs of cyanosis or pallor. Can I see your fingers? There's no clubbing. And she's pink. And these are good signs of oxygenation. Her thorax is symmetrical with no visible deformities. Anterior posterior transverse diameter is approximately 1 to 2, which is normal. Her breathing is quiet, regular, and unlabored. There's no abnormal findings. There's no cyanosis, use of accessory muscles, or barrel chest, and these may indicate respiratory distress or chronic pulmonary diseases. I'm going to palpate her trachea. Her trachea is midline, anterior chest. There's no masses, no areas of tenderness. Can you take a breath for me? Her chest expansion is symmetrical bilaterally. I'm going to do check for tactile fremitus. So can you please say 99?
99.
And again?
99.
Good. Tactile fremitus is felt equally on both sides. Now can you turn around for me? I'm going to palpate her back. There's no masses, no areas of tenderness. Can you take a deep breath? Her chest expansion is full and equal. And I'm going to check for tactile fremitus again.
99. 99. 99.
Yes, and tactile fremitus is felt equally on both sides. Okay, so now can you turn around? Now I'm going to be percussing her anterior chest. So there's resonance throughout. And now can you turn around again? Okay, so there's resonance throughout. So now I'm going to be checking her diaphragmatic excursion. I'm going to ask you to exhale and hold your breath, and I'm going to be percussing till dullness. Are you holding? Okay. It's here. And now I'm going to ask you to take a few breaths and inhale deeply and hold your breath. And I'm going to be again percussing until dullness. So there's the difference is about 4 centimeters, which is normal. Okay, now you can turn around. Okay, so now I'm going to be auscultating her breath sounds. Take a deep breath. Mm-hmm. Take a deep breath. Okay, good. And turn around. Okay. Okay. So her breath sounds are clear to auscultation, with no adventitious sounds. There's no wheezing, no rails, no rhonchi, no crackles. Now I'm going to be doing the cardio. You can turn around. The cardiovascular assessment. So I'm inspecting her face, lips, and eyes. There's no signs of pallor, cyanosis. Her hands, there's no clubbing. Her feet, there's no edema. No lower extremity edema. I'm looking at her precordium, and there's no lifts or heaves or visible pulsations. Oh, can you lay down for me, please? At 45 degrees degree angle, there's her jugular vein is not distended, which is a normal finding. Okay, sit up. Now I'm going to be palpating her precordium. There's no thrills or abnormal vibrations. The point of maximal impulse is located at the 5th intercostal space, mid-clavicular line, which is in the normal location. Okay, now I'm going to be checking her pulses. So her carotid pulse. Is symmetrical, equal bilaterally, +2. Now the brachial pulse. Symmetrical and equal bilaterally, +2. Ulnar pulse. Symmetrical and equal bilaterally. Now popliteal pulses. Symmetrical and equal bilaterally, +2. Now the dorsalis pedis. Symmetrical and equal bilaterally, +2. And the ulnar, the posterior tibial. symmetrical and equal bilaterally, +2. Now I'm going to be checking the capillary refill on her hands, less than 2 seconds, and her toes, which is less than 2 seconds. Now I'm going to be auscultating the 5 main valve areas of her heart. So now I'm checking her aortic valve, which is located in the second intercostal space on the right side. And now her pulmonic, which is also in the second intercostal space on the left side. Now Erb's point in the third intercostal space on the left side. And the tricuspid on the fourth intercostal space on the left side. And the mitral valve on the fifth intercostal space, mid-clavicular line. Okay, so S1 and S2 are clearly audible. There's no murmurs, rubs, or gallops. So, excuse me. So this 18-year-old female presents with a normal thoracic, pulmonary, and cardiovascular findings during today's assessment. The ICD diagnosis is Z00129, which is the encounter for routine child health examination without abnormal findings. So now some anticipatory guidance that I would like to discuss with my patient as she's 18 years old is that it's important to schedule a wellness checkup every year. And at age 21, you will need to have a pap smear. Also, your mental and emotional health are just as important as your physical health. So if you feel anxious or overwhelmed, you should talk to someone. If you're sexually active, you have to practice safe sex by using condoms. Also try to eat a balanced diet, which includes fruits, vegetables, whole grains, lean proteins. Also try to aim for to have physical activity every day. Avoid tobacco, vaping, alcohol, and drugs. And always wear your seatbelt when you're driving and never text when driving. Do you have any questions?
No.
Okay, so that concludes today's assessment. Thank you for watching.